I will say you have to sign up. And let me tell you why. There's a lot about physical examination and clinical examination. So a lot of the information that you will get, you can apply also to your everyday activity. There's also a lot on radiographic reading. We speak about patelloaxation. We speak about CATs. We speak about analgesia, physiotherapy. So there is such a variety of topics that I believe they make it like a very, very usable resource. So for me, there are no big reason to not sign in. I feel that someone that maybe has recently finished or maybe is going into profession and wants to improve in a very specific area, which is very important for everyday practice. You know, in clinical practice, you will see this problem. And this is a great resource, but also for a vet that is already experienced and maybe wants to get up-to-date information. Maybe also wants to go in more depth. And here in every module, we're delivering information, but then we're discussing through clinical cases. So I believe that this is really unique and should allow the vet to transfer this information directly into clinical practice, because maybe the clinical case that I share are something that I collected over many years. And now I'm sharing them over 1 hour. And I believe that this will help a lot because we're going in detail on common but also less common clinical cases. The topic that we selected for this lecture series is stifle and specifically cranial cruciate ligament disease. We selected this topic because this is probably the most common orthopedic problem that we see in dogs, maybe together with hip dysplasia. In this topic, we're covering a lot of different aspects. We speak about anatomy, we speak about clinical examination, and we will also cover other pathologies, such as, for example, meniscopathology and medial patelloaxation combined with cruciate ligament rupture. I think it's a very, very important topic for the surgeon, the specialist, but also the general practitioner, because cranial cruciate ligament disease is probably the most common orthopedic disease that we see in dogs, or at least one of the most common. The first point is important because cranial cruciate ligament injury includes a variety of aspects, and it's not easy to go in such in depth through a book or through maybe reading a review paper. And so by listening to very experienced speakers and also very skilled speakers, the attendee can hear about their experience, can hear about the topic as they would read a book, but can also hear the discussion about clinical cases. So there is the knowledge that they can acquire, but then especially they can hear the discussion on clinical cases and they can transfer this information directly to the daily work. So the idea was to collaborate with VetPD to develop something unique. The idea was to develop really a series of webinars, a series of lectures, combining some of the best speakers out there and a new format. A format where there would be interaction between two top speakers. One main speaker that would lead the lecture and the discussion, and one discussant. So in this lecture series, actually, that we designed, we go from the basics and we really cover all of the topics, and I selected the best speakers for that specific topic. So that's how I really see what is novel and unique. And then last but not least, just availability. You know, you're sitting back home and you can register and listen to the online lecture, which is going to be pre-recorded also, which is going to be recorded. So for all of these reasons, I believe that it would be an amazing resource, very unique for people that are interested in cruciate rupture. This lecture series will be also a great resource for residents, for surgeons in training. I think for two big reasons. The first one is that this is a broader review of the topic. You know, we go from surgical anatomy to diagnostic imaging, decision-making, surgical technique, surgical complications, post-operative management. So a really broad overview of cruciate ligament injury. And the second big reason, in my opinion, especially myself training residents, we have a lot of case discussion. And I think a clinical case discussion is great, and it's very important for preparation for the board exam.